Run your tongue along your teeth right now. Go on. You just did it without deciding to. You brushed them this morning, half asleep, thinking about something else entirely. And if one of them ever starts to throb, you know exactly what happens next: a phone call, a waiting room, a chair that leans back, and a numb jaw for a few hours. That whole routine is a rounding error in human history. The pain isn't. Toothache is older than dentists, older than cities, older than farming, older than the alphabet. Our ancestors were clutching their jaws in agony long before anyone had invented a word to describe it. And here's the part that should genuinely unsettle you: for most of human history, a bad tooth wasn't an inconvenience. It was a way to die. So the question is, what actually happened when an ancient human got a toothache? And when, exactly, did somebody first look at a screaming, swollen-faced friend and think, I could fix that? Let's start with why the pain is so uniquely awful. A tooth is a strange bit of engineering. Hard armored shell on the outside, and buried in the middle, a soft chamber packed with nerves and blood vessels. That chamber has no room to swell. So when bacteria eat through the enamel and reach the middle, the tissue inflames, the pressure has nowhere to go, and it presses directly onto the nerve. That's the throb. That's why toothache doesn't feel like a normal injury, it feels like something drilling into your skull. And it doesn't stop there. If the infection escapes the bottom of the tooth, it gets into the jaw. From the jaw it can get into the soft tissue of the neck and the floor of the mouth, swelling until the airway closes. Or it gets into the bloodstream. That's sepsis. That's over. A cavity, left alone, can absolutely kill you. For thousands of years, it regularly did. But here's the twist, and it's a good one. For most of our history, we didn't get many cavities at all. Cavities aren't really caused by sugar, in the abstract. They're caused by the bacteria in your mouth feasting on carbohydrates and excreting acid onto your enamel. So if your diet is meat, fish, roots, leaves, and the occasional handful of berries, the bacteria go hungry. Look at the teeth of a typical Ice Age hunter-gatherer, and they're often worn flat as a table from grit and chewing, but remarkably free of decay. Then farming arrived. Grain, bread, porridge, stored starch, sticky sweet things. We handed those bacteria an all-you-can-eat buffet, and rates of dental decay across the ancient world climbed. Except, and this is where it gets interesting, the rot started before the farms did. At a site called Tafrelt, in the caves of Morocco, archaeologists found the remains of foragers from roughly 15,000 years ago, well before agriculture. And their teeth were wrecked. Cavities everywhere, in the majority of the population. The reason seems to be that they were heavily harvesting wild starchy foods, things like acorns and pine nuts, sweet, sticky, carbohydrate-rich, and clinging to the teeth. Which means the world's first dental epidemic wasn't caused by farming. It was caused by snacking. Same, honestly. I'd have taken the acorns too. So people were in pain. The obvious question is what they did about it. And the earliest answers are pure improvisation. The very first dental tool was the toothpick. We know this because we can see it. Look at Neanderthal teeth from sites like Krapina in Croatia and you find little worn grooves along the sides near the gum line, the signature of something being poked in there, over and over, by an individual with sore, inflamed gums trying to get relief. Tens of thousands of years ago, a Neanderthal with a bad mouth was sitting there methodically picking at it. Just like you do with a bit of popcorn stuck in your molar. And they went further than that. At El Sidrón in Spain, researchers examined a Neanderthal jaw showing a dental abscess, and analyzed the plaque still stuck to the teeth. Inside it they found traces of poplar, a plant containing salicylic acid, the natural compound behind aspirin, along with a mold from the Penicillium family. A Neanderthal with a raging tooth infection was chewing on painkiller bark and moldy plant matter. 50,000 years before anyone wrote down the word medicine. But relief isn't repair. To repair a tooth, you have to do something genuinely terrifying. You have to attack it. And somebody did. At a rock shelter called Riparo Fredian in Italy, researchers examined two front teeth from around 13,000 years ago. Under a microscope, the cavities in them showed unmistakable marks, striations left by a sharp stone tool being scraped and rotated inside the hole to clean out the decayed tissue. And clinging to the inside were traces of bitumen, a natural tar, along with plant fibers and hairs. Someone drilled out the rot with a flint point, then packed the hole with tar. That's a filling. That's a filling made in the Ice Age. Then it got systematic. At Murghar, in what's now Pakistan, archaeologists uncovered a Neolithic burial ground where multiple individuals, around 9,000 years ago, had holes bored into their back molars. Perfectly round, clean-walled holes, in the chewing surfaces of teeth where cavities form. The likely tool was a flint drill bit spun with a bow, the same technique those communities used to drill beads. Bead makers, retraining as dentists. Same drill, different patient. And the holes show where afterwards, which means these people kept chewing for years. It worked. A little later, in Slovenia, there's a jawbone roughly 6,500 years old with a cracked canine. And sealed into the crack, a patch of beeswax. Now here's what makes this so important, and it's bigger than teeth. Think about what a filling actually requires. You have to understand that pain has a physical cause hiding inside the body. You have to believe you can reach it. You need a tool precise enough to do it, a material to seal it, and, crucially, you need another human being willing to hold a spinning flint against your face while you sit still and trust them. This is one of the first times we can see humans doing surgery. Not comfort. Not a poultice. Actual intervention. Someone diagnosed a problem, opened the body, removed the diseased part, and closed it back up. 13,000 years ago. The impulse behind modern medicine is sitting right there, packed in tar. Of course, not everyone got the science version. When the first civilization started writing, they wrote about the cause, and they got it gloriously wrong. Ancient Mesopotamian tablets preserve a story often called the legend of the worm, in which a worm begs the gods to be allowed to live inside the gums and drink the blood of the teeth. The tooth worm. That explanation stuck around, across continents, for thousands of years. Which is fair enough. A dark hole appearing in solid bone genuinely does look like something burrowed in. And then dentistry became a job. In Egypt, on a tomb from around 4,600 years ago, a man named Hiziri carries a title that translates roughly to the greatest of those who deal with teeth. The first named dentist in human history. Centuries later, the Etruscans in Italy were building bridges and false teeth held together with bands of gold, part repair, part jewelry, part flex. So here's the full picture. First there was just the pain, and nothing else. Then a Neanderthal picked at his gums with a sliver of wood and chewed aspirin bark. Then foragers in Morocco ate too many sweet acorns and invented the cavity epidemic. Then someone in Ice Age Italy drilled a tooth and filled it with tar. Then Neolithic beadmakers turned it into a practice. Then a man in Slovenia got a beeswax patch, Mesopotamia blamed a worm, and Egypt gave the job a name. And every step of that ends with your tongue, running along your teeth, just now. That little check you do without thinking is 100,000 years old. It's the oldest self-diagnosis there is, a body quietly asking itself, is anything wrong in there? The difference is that when the answer is yes, you get a chair and an injection, and they got a stone and a friend with steady hands. We are the animal that decided pain was a puzzle instead of a fate. It started in somebody's mouth, with a piece of flint, and a lot of nerve. If you like your history uncomfortably close to home, there's plenty more of it around here.